So thank you everyone for coming. I do apologize for not having a meeting last month. Rest assured that I can vouch for many of us who are on here now that we were very busy. We just didn't feel that taking up an hour of your time was valuable. So it happens. It happens. But so what I'm going to do is go around the room and have each of you introduce yourselves. Let us know where you're from, what organization. My name is Kevin Marshall. I'm a sergeant on the Nantucket Police Department. I am one of the chairs for this group. Sue.
I am Sue Mintonen, and I am with NAMI on Nantucket.
Jackie.
Jackie Lane. I'm the executive director of NAMI Cape Cod and the Islands and on Nantucket.
Suzanne.
Suzanne Franzuto. I'm co-coordinator of NAMI on Nantucket with Sue Mintonen, and also an advocate at a safe place.
Erin.
Hi, Erin Russell. I am Outpatient Director at Gosnold, and I oversee the Nantucket office.
Sherry.
I'm Sherry Lewis. I'm filling in for Deb Gately today. I'm with Nantucket Public Schools and the coordinator of Student Support Services.
Awesome. Let me write that down. Amanda.
Hi, Amanda, the clinical director at Fairwinds.
Who did you call? I didn't hear it.
Brooke.
Oh, me. Okay. Hi, Kevin. I'm Brooke Moore. I currently sit as chair of the Council for Human Services.
Thanks. Elise.
I'm Elise Norton from the Nantucket Family Resource Center.
Jericho.
I'm Jericho Mealy, Department of Human Services head, working for the town at the moment.
Thanks. Chris.
Hey, Kevin. Chris Glowacki at the hospital.
And Don.
Hi, I'm Dawn Hines from Hines Recovery Services and Eating Disorder Organization.
Awesome, thanks. Barbara, I'm intentionally skipping you until it's time to introduce you.
No problem.
Okay, so just looking at the agenda, are there any updates from the organizations? I know that the police department has a few updates, but I'll let someone else talk if there's anything that they want to bring up at this meeting. No.
We just Gosnold. We started the SOAP program on February 1st. So that's in full swing. So if anyone has a referral, you can reach out to me or call the Nantucket office and we can get someone in. It's primary substance abuse. And we're excited that we started it.
What's the name of the program?
It's called SOAP, but it's Structured Outpatient Addiction Program.
Okay, and what kind of person would you want? At what stage did somebody go?
So it's really that, yeah, no, that's a great question. So it's really that intermittent level of care. So anyone that is stepping down from a higher level of care, say detox or a rehab level of care, or anyone that's in the community that needs a little more support, that maybe is struggling with returning to use or has increased, they can't really be actively using in the program. If they had used the day prior and had they been in recovery, then of course they can come, because returning to use is part of that process, but they can't be like actively using on a daily basis. But we can support, it's really that medium level of care. So step down or step up from what they have currently.
Okay, and is that offered on Nantucket?
Yep, it's Tuesday, Thursday, and Friday.
Awesome.
It's a hybrid model, so if they don't want to come to the office, they can go in through our Zoom, but they can go in person if they need to or want to.
Great. Do you have clients already?
So we have one person in the program right now. They've been in there since the day one. And we just had another intake today. So we have 2 right now. So we are actively, with NAMI's help, marketing the program and hoping to get up. You know, we would be happy with like 5 or more.
Okay. Awesome. Thanks. Anyone else? I know that the police department is actively working on coming up with the task force, which would be a preventative measure. Any individuals that would have called us for services, whatever those services may be, we're basically mimicking what the town of Dennis is doing. So the police officers with a clinician would then go out and provide them with the necessary resources, making sure that they're connected to the care necessary. So we're trying not only to focus with mental health, but also domestic violence or any other services that may be needed. Not that we want to take the helm on this, but I believe, and I don't want to speak for the chief, but I believe his thinking is that while we're already connected to that person, we don't want to waste the opportunity to make sure that we're providing them with the necessary resources to get further help. So that's coming down the pike. With that said, I also have a few stats, if I can pull it up real quick. So the challenge will be determining how many hours are going to be required. And I know I'm going to have to talk to Jason and even Jericho at some point next week, maybe. But the numbers, as far as the responses from the police department, have in fact gone down. We had a total of 48 calls for service related to CIT mental health. And that could be anything from someone who is on substance abuse or substance use or an actual mental health crisis. But to give you an idea, 2020, we had 73. So the fact that we only had 48, you could say that COVID played a role in that, or it could be all the great work that we're all doing. So I'd like to think the latter is what's making those numbers go down. In 2017, it was 78 people. In 2018, it was 75. 2019, it was 64. 2020 was 73. And then 2021 was 48. So there's a drastic difference in 2021, which is a really positive thing to happen. So hopefully the numbers will continue to go down. And I think the collaboration that we're showing, not only with this group, but other groups throughout the island is playing a huge factor in that. And the police department continues to provide trainings, suicide prevention trainings, mental health first aid. We've been asked to do a second one for this year. So we're continuing to do proactive work through our agency, which is great. While I had, where'd she go? Sherry, have you through the school ever heard of Hope Squad? Okay. It was a peer-to-peer program that came out of a state out west somewhere where they had a couple of suicides in the school systems. It's costs a little bit of money. I'm going to look a little bit more into it, but I know you're always getting inundated with programs that you should be implementing in your school system. So I didn't know if you would be the contact for just a discussion on that, or who I would go to for a peer-to-peer suicide prevention group.
I'm sorry, I was having problems muting myself. So I would be that contact person.
Okay. I'll shoot you an email with the info.
Okay, great. Thank you.
Kevin, if I may, real quick, I would also love to hear anything you have on this when you start doing the peer-to-peer thing, just looking up on that myself.
Yeah, it was interesting. The numbers, it's a little bit expensive, but I'm always thinking that if peers are the ones who are choosing the peers to be those role models, I think it could be impactful instead of having the adults say whatever. All right. Anything else? Jackie, did you have anything through NAMI?
Nothing new. We're just going on and doing our stuff. Okay. We're very happy that we have a borderline personality. program underway, and that we have people trained on Nantucket to run one. Hopefully our programming will either be hybrid or live, combination of the two, rather than just Zoom.
Awesome. Okay.
Can I
Jackie,
pop in? Oops.
sure.
I just wanted to say that the Warming Place, which is the daytime, 2-day-a-week sort of warming shelter, is finishing this month, but we're still going. We've moved to the Summer Street Church, and I think we've made referrals to a number of agencies represented here, and so we're grateful for all the support of our guests. And if you have folks that need a place to go during the day, maybe need a meal, cup of coffee, please let them know. Summer Street Church, Monday and Thursday mornings from 8:30 to 1:30.
Do you have any data on that? How many people had been attending?
We have had 6 different individuals come in. We have a few that are regulars, and that have sort of taken advantage of us doing some very light case management and referral work, but we're just trying to get them services that they could use that help them out. So that's our current. We know there's others out there, but I think some folks might have jobs. Other folks are resistant to our vaccine requirement.
Right. Okay. Anyone else? Hi, Jason. Okay, Jackie, did you want to introduce our guest speaker?
Certainly. Barbara Dominic has been very active in children's services on the Cape. At the present time, she's a consultant for Barnstable County in a project that has been underway for 3 or 4 years now, and that's kind of inventorying the services for children on the Cape, the lack thereof, and figuring out what to do about it and calling attention to it. Prior to that, Barbara was a school counselor in the Nauset school system. So she's had a lot of experience on the ground, and she's been coordinating this program. And I was in on it from the very beginning. It was very interesting because it actually got started because a person who took in foster children in an emergency, it's a child like the 2 or 3 or 4-year-old that's scooped out of their parents' house because of an incident. And she was a former officer at DMH on the state level, and she was shocked to find that when she took a traumatized 4-year-old into her house, that there was no way to get any kind of therapeutic counseling for them on a timely basis. And that then she got a group of people together, and there were about 12 of us met, and it developed into this large organization that has many, many members, and they meet monthly, and we have several subcommittees. So Barbara, I'm going to let you talk about the rest of it and where we're at and what we do and how it kind of lines up with what we're trying to do on Nantucket. In other words, a continuum of care, but this is specifically for children. So Barbara, welcome, and thank you for doing this.
Thanks, Jackie. Thanks for inviting me. First, I want to tell you just a little bit of background about me, and it's important because I have a distinct advantage in doing this work based on my background. So as Jackie said, I am a retired school adjustment counselor with Nauset. I was there for 16 years, but I also have a very long, I won't tell you how long, so I don't date myself, a very long history of social work in a number of different settings, both here and in the Washington, DC area, including private practice. So I've been around the block a few times, and that experience all comes in handy for the work that I'm doing now with the Barnstable County Department of Human Services Children's Behavioral Health Work Group. My other advantage in doing this work is that I know most of the people who are in this work group and interacted with them before as a school adjustment counselor. So as you know, when it comes to forming collaborative groups, it's all about the relationship. So I had a leg up because I already knew most of these folks. So as Jackie said, the Children's Behavioral Health Work Group, I don't think that's the name it started out with. I'm not sure we had an official name, Jackie, but it actually began in February of 2019. And as Jackie mentioned, a woman who was a former high-level state and federal administrator in Department of Mental Health issues, retired, came to the Cape and became a foster parent, and very quickly discovered a situation that's probably very familiar to you and in lots of places. She just couldn't get mental health treatment for a young child. So she started this work group as a grassroots movement. And I love to tell this story because I think it's a real success story, because here we are 3 years later, we are still operating, thriving, growing, and that's never an easy feat to put together a group like this. So Eileen got it started with her clarion call out to the entire behavioral health community that we need some help here. So as Jackie mentioned, and I can still picture, Jackie, back in February 2019, a large group of folks from just about any human services agency you can think of on the Cape. There were people from the faith community there. We all got in one room and started talking about, what can we do about this? You know, where are the problems? What can we do? What kind of brainstorming, what kind of problem solving can we do? And so by October of 2019, which is when Beth Albert, the then, director of Barnstable County DHS, took over the work group as the chairperson. By that time, we had a formal recommendations and action plan, which was a collaborative effort from everybody in the group. And it was broken down into areas of need, everything from what services we need to have on the Cape, which includes things like partial hospitalization programs for kids, CBAT beds for kids, to what are some of our regulatory issues, how are mental health services provided within the schools. So it was a pretty comprehensive scan, and Beth Albert actually hired a consultant, a different consultant, to do a system scan. So that gave us a good first, anecdotal picture of what we have, and more importantly, what we don't have. And that really has sort of guided our work from there. Jackie mentioned that we have subcommittees that have been formed based on identified priority areas of need. One of those Jackie is involved with me directly, which is the School Mental Health Subcommittee, to not only study how mental health services are provided to school kids, because that's where a lot of the referrals come from, but also to understand how we can be supportive of them. So we did a focus group, and from that we built a survey for the school counselors to really find out, what do you need? What do you need from us exactly? And one of the things that they asked for, and this was almost unanimous, was they wanted a collaborative group from one end of the Cape to the other, to be able to meet on a regular basis, to support one another, to learn together, to problem solve together. And that is still active now. And I think, Jackie, it's fair to say, you can let me know, I think even though we are passing through a growth period, I think that we've done some really important programming for the school counselors, and we'll continue to do that. For example, our March meeting will have a panel of human services providers from agencies where school counselors are most likely to try to turn to for services for their kids and families. So we're having a special 2-hour meeting in March for that. The other subcommittees involved just trying to sort out some of the regulatory issues around outreach versus satellite offices, because I'm sure that you confront this in Nantucket just as well. We have many larger agencies that are based more in the mid and upper Cape area. In the outer and lower Cape, not so much. And so we wanted to take a look at just what are the regs that have to do with satellite and outreach offices, and how we can take a look down the road at creating some of those and understanding any regulatory barriers to that, which honestly, there didn't seem to be many. So that was another subcommittee. We had another subcommittee on student loan forgiveness programs as part of our behavioral health workforce. initiative, which is huge. I don't need to tell you that that's where it starts, really. And one of the issues that was brought up in the group is the starting salaries for workers in the behavioral health field are generally so low that to add a student loan payment to that is even more critical. So we did some initial learning, really. It's complicated, both at the state and federal level. And I think from the time we had our subcommittee meeting to now, some of the policies and benefits have changed. But I'm only mentioning that because that's another area that we focused on in our subcommittees. And we more recently formed a small clinical group to try to have some more nuts and bolts conversations about actual clinical services. And we've done a lot of outreach to Department of Mental Health and tried to engage them in conversation and having them meet with our group. So, and what we've learned, I think, is that that's where in the subcommittees, that's where the work gets done. I don't know if you would agree with that, Jackie, but, we have a large group. Not everybody attends every meeting. And like many groups like this, there are people who have varying levels of engagement. Some people show up to meetings and they really are there to listen, which is totally fine. And then we have others who are really more invested in the nuts and bolts and getting the work done. So, so we formed a small group to take a look at that. We have representatives from almost 30 agencies on the Cape, ranging from home health care to school representatives, to Cape Cod Healthcare, to Department of Mental Health. Department of Public Health has participated at times, Gosnold, DCF, and we have representatives from our state senator's office who actively participate in every meeting. So we've got a really, really good cross-section of folks. So I think we've represented well the human services community. The rub is always, okay, now how do you get the work done? Which is it's a constant project. How do you get the work done? We've spent a lot of time on advocacy, honestly. Advocacy at the state level, advocacy with important state agencies that are potential funding sources or potential partners for any programming. Agencies like DMH, for example. Because what we learned is, and you may be able to relate to this, is that the system of funding and program developed from the state level, it's very Boston centric, for lack of a better word. We don't always get the first look, those of us on the Cape, and it may very well be true for you. So we spent a lot of time advocating, building relationships, introducing conversations about just what our needs are on the Cape, understanding that the biggest money and the biggest programs are going to go where the people are. But our emphasis has been, okay, but we're people too. We may not have as many, but we're people too who have the same needs. So that is an ongoing focus, and I think a primary focus for us. Our mission statement, which I think really kind of just says exactly what we do. Our mission statement is to increase access to and maximize the efficacy of the Cape and Islands behavioral health system of care for children, adolescents, and young adults ages 0 to 21 through collaboration, advocacy, education, and training. So we have organized, and one training we had recently was with our school mental health subcommittee. This was, Jackie helped organize this and was instrumental in actually funding it. Presentation from Stuart Ablon on the Think Kids program that was presented for all of our school counselors. We've also had presentations on the HIPAA regulations. There was some concern expressed about understanding of HIPAA regulations and how they may or may not impact care. And then we always devote some of the time in our group for just general discussion with one another about program updates, announcements, and just brainstorming. So we meet monthly. Right now, of course, like everything else, we're meeting via Zoom. We tried for a little while before the Omicron variant to have a hybrid model, and we were rotating locations, meeting locations among the agencies that are represented by members of the work group. And then that kind of got shut down when the Omicron variant took us over. But we hope to get back to hybrid and eventually in person sometime soon. I'm going to just take a quick look at some notes I made here to make sure I don't leave anything really critical out. I think those are basically the nuts and bolts of the program. We have representation from one end of the Cape to the other. It's taken a while to build that. But through connections, through networking, we now have representation really from Provincetown to the Upper Cape in our group. And as you can imagine, working together, collaborating, establishing shared goals, it's always a work in progress, but I think that there is genuine interest and energy in working together to try to solve some of these gaps in behavioral health care for kids. So those are the nuts and bolts of the program. I'm happy to answer questions, have some conversation about it. I enjoy talking about it because I think it's really a good case study in collaborating, which is not always easy. So I'm happy to entertain questions and discussion.
Barbara, one of the prime things we did in that was the scan. You mentioned that earlier. And I was wondering if you could enumerate the gaps that we found so those on Nantucket could compare what they have and see if there are things that we have that they don't.
Let me take a look at that, Jackie. Let me see if I can pull that up. And while I do that, let me just say that that was our foundation, the system scan, because it gave us a first look at what the gaps are. What we're working on now is really to try to move into a comprehensive needs assessment, a really in-depth needs assessment from one end of the Cape to the other, because what we've learned is that advocacy anecdotal information only goes so far when you're advocating for programs and funding, especially funding. So we are working on and looking at, and we'll be looking for a consultant to do a comprehensive needs assessment that would involve, focus groups, survey development, and really take a good look from one end of the Cape to the other. But give me just a second here while I pull up the system scan. I was just looking at it. Okay. I don't think I can share my screen because I don't own the meeting, but I'll just kind of go through some of what we
I can let you share if you'd like.
Okay, that'd be great.
Okay, go ahead.
Okay. Okay, as you can see, this is an Excel document, so I'm going to fight my way through this because I am far from an Excel document expert. But these are, okay, these are just some of the general areas that we took a look at. And what it might even be more helpful, Jackie, is for me to share our recommendation and action plan. Because I think, let me pull that up because that really speaks more to, that really gets down to the specifics. So give me just a second to bring that up.
Well, as all of you know, Nantucket has done this in-depth assessment recently, and we have a steering committee that's working on where to go from there, which is probably toward a professional strategic plan. And the Nantucket one is for mental health as a whole. This is specific to children.
And actually, we expanded the age group from, it was 0 through 17, I believe, but we, in thinking about a needs assessment, we decided to really expand it further up to age 21. Okay, I'm combing through my Excel list of docs. Let's see. Okay. Okay, let me share this now. This will give you a better look, I think. Okay, that's still not the one I want. Okay, Jackie, maybe you could hum a little something while I look for the our current one, because that's a lot more descriptive for what I think you want.
No, what I'm trying to determine with is the parallels between Nantucket and the Cape.
Right.
And because
Here we
on
go.
Nantucket, I'm part of the steering committee, and we're trying to figure out our priorities. And those of you, some of you are on that steering committee that are on this.
Right. So that's why, thank you. So that's why I went to this one. This is the most up-to-date recommendation action plans. This spells out a whole lot more, I think, what you're looking for. So the very first section in this talks about expanded and evidence-based integrated models of care. Some of these we've tackled and some of them we haven't been able to yet. But for example, this first one of the members of our group is from Children's Cove, and she talked about the need to maybe offer training to other local therapists and providers on working with kids with sexually problematic behavior, because what we were finding was not only is there a shortage of providers, but a shortage of providers who feel comfortable working with this population. So the intervention here was to offer some training, which we've done. We've had a very short-term training program. And we're kind of looking to other areas of training to offer too, just to kind of boost the provider capacity using what we have and equipping the providers that we have with some additional training so that they feel comfortable and they're competent to treat some of these students with specific, or some of these children rather, with specific problem areas. Okay. All right, I'm going to skip down to this one, Jackie, because this was a recent topic. So these are the programs here in section 2. These are the essential programs that are currently not available on the Cape. Some of them were at one time, but they were discontinued. And again, it's about numbers. But I mentioned earlier the community-based acute treatment for kids. It's short-term in-person treatment. Right now, at least for those of us on the Cape, if you have a child who needs that level of care, they have to go over the bridge for a referral. And even at that, finding a bed is very, very difficult. Partial hospitalization programs. There used to be one, there used to be one in Hyannis, actually, years ago when I first came to the Cape. That doesn't exist. And then we have the whole issue of ER boarding, which you probably do too, where kids and adults for that matter, but here we're talking about kids, end up staying in the emergency room way too long while they're waiting a bed for placement. And then in some cases are discharged without the appropriate treatment or a bare bones level of treatment that they need. So, so we don't have things like an intensive outpatient program. We certainly don't have long-term inpatient beds on the Cape. We have, and Aaron, you were just talking about the structured outpatient program that Gosnold's going to be offering, but for Nantucket, I don't know, does Gosnold have this program on the Cape?
Yeah.
They do,
Yeah,
okay.
this it's for 18 plus. So that demographic from 18 to 21 can utilize that service, but the SOAP program is 18 plus. And we have a partial in Centerville too, but again, that's 18 plus.
Okay. All right. Mental health urgent care, that would be, in this case, that would be Bay Cove Emergency Services. They do to some extent monitor time in the emergency department and the discharge outcome. And we periodically, we check in on those stats to see just how long kids are staying in the emergency room on average, and then where do they go after that, and what kind of services are they able to receive upon discharge. This is a very specific area, Recovery High School. One of our work group members works with and is actually the founder of the Recovery Build program and has been advocating heavily for not only a recovery high school, but some other programs within the schools to really help kids avoid suspensions and really receive a much more beneficial level of intervention. So those are the specific program areas. And then we, in our action plan, we looked at, and this is another topic of constant conversation, the behavioral health provider workforce. Mandy Speakman, our assistant, our deputy director rather, and I recently participated in a meeting with Mass Hire because they've received some funding for a behavioral health workforce project. I don't have a good sense of what that will look like or how active it will be because we just had one meeting. So stay tuned on that one. But in general, workforce issues are huge. And what we run into on the Cape, and I'm sure you do too, is the cost of housing. Folks who are earning an entry-level salary in the behavioral health field without some help, they're going to have a hard time, certainly for sure buying a home, and secondly to even find a rental property. So that's one of the barriers. And the feedback that we've gotten from agencies who have tried to hire is they've gotten all the way in some cases to someone accepting a position and then having to say, oops, sorry, I can't take it. I can't find housing. So we're all wishing we had a magic wand for that one for sure, because that's a huge piece of the problem. And then there's a whole, without getting too far into the weeds, we've studied some rate and reimbursement issues. That state legislature has taken that up, and some other sort of in the weeds clinical issues. Licensure, we have a subcommittee that met with the Licensure board, which is now transitioning over to Department of Public Health. I don't know if you're aware or if you have clinicians who have complained about this, but until now in Massachusetts, there was one department that managed licensure applications for everything. Whether you were applying for a plumber's license or to be a licensed independent clinical social worker, they all went to the same mailroom. So that's changing. The allied health profession licensure board is now slowly being positioned in Department of Public Health. So hopefully that will help ease some of the backlog with licensure issues. Jackie, is this?
Say that this panel that you have is all school employees?
No, we have a subcommittee that formed a group for school counselors. But our panel, our larger work group, I'm glad you asked that. Our larger work group covers almost 30 different agencies, including our state senator's office. So it's a very diverse group of human services providers.
Yeah.
Jackie, is this getting at what you wanted to highlight on this plan? I know it's probably more than that, but is this getting at what you were thinking of?
Yeah, well, first of all, I was trying to coordinate what we're doing with what we're trying to do on Nantucket. And I think that a lot of this information, and I probably have these somewhere in a folder, but that this is information that would be very helpful as we go forward on Nantucket, because the similarities, I mean, working both areas on a daily basis, the similarities, as I've always said, and you've heard me say it, Nantucket is just like the Cape, but it's on steroids, because everything that all the issues we have on the Cape are just more magnified on Nantucket, because it is an island, it's a smaller population, it's even more isolated, and it's even more expensive. So all of that, but I think all of this information is very valuable information for what we're going to have to be trying to do as we move forward. And as I said, this is basically on the continuum of care for children, and we're doing the whole thing, but children certainly is a very important part of it. So I wanted people to kind of get a glimpse of what we've been doing basically on our own without a lot of professional help, really. And then, but you're absolutely right, in order to get funding, you can't have anecdotal data. You have to have it in dollars and cents and numbers in order to prove your point. And so we're kind of at that, but so it's very similar. But I want to thank you so much for bringing this to us, because I think it's very useful information. And if anybody has any questions for Barbara, now's the time. I think you'll see the same thing here as you see on Nantucket.
Jackie, I just want to I'm sorry, I just wanted to back up to the school counselor's question for a minute, because I really want to emphasize this, how we do devote a lot of time to supporting school counselors. First of all, because that's where most of the referrals come from. You know, they're with our kids all day, every day, and they see these kids interacting in the school environment and are really kind of hands-on with trying to get help for these kids. So so we have a separate group for them, but we try to bring them in as much as possible to the larger group. So, and I interrupted a question. I'm sorry.
Well, that was going to be my question. So, so you say you have individuals from the end of Cape to the beginning of Cape, and in your mission, you point out that you're including the islands, but do you have any representatives from either island?
We have reached out, but admittedly, it's probably going to take more than one or two outreach efforts. We have reached out and would certainly love to have representatives from the islands. Yeah. So I think we have a student services director on the call. I would love to connect with you about that, because yeah, we'd love to have you join.
I just know when I go to, I'll use school resource officers, when I go to the Cape and Islands monthly meetings to learn about what other districts are doing, it's quite helpful to bring it back here to see if we could implement whatever the conversation is here. And 90% of the time it is beneficial to us. So I know that those meetings that I go to off island are helpful. And you could say that for any organization.
Well, you're welcome to join anytime, but I would love to hear from either by email, or we can talk now. I'd love to hear from the school representative, because we would be very, very happy to include reps from the islands. This is a work in progress, even though it's been around for a few years, but we're constantly adding, changing, revising. So I would love some names to reach out to within your school system.
Yes, Barbara, I would love to be part of that. So feel free to reach out to me.
Okay. Hi, Sherry. So I don't have your email address, but
I have yours, so I will email you my contact information.
Perfect. I'll look forward to that. Thank you very much.
Thank you.
Sure, of course. Any other questions?
I was going to ask Sherry if you still have openings for school counselors. I know a couple meetings ago that was an issue.
It still is an issue. So and it's for social workers. And so yes, we still have openings for social workers. If you know anybody who wants to apply, We're trying to do some things through telehealth right now for our general ed students, but and I've started talking to some of the local clinicians on island. So hopefully we might be able to provide some in-person services here.
Sherry, if you have a job announcement, feel free to send it to me because I have several different email networks, one of which is the work group, but I'm happy to share a job announcement if you want to pass it on to me.
Okay, thank you so much, Barbara.
Of course. Those are always the sought after jobs too. So that says a lot.
Barbara, I will send a job announcements to you as well. I think I'm from Fairwinds. I think we met on the suicide prevention call. The Cape and Islands that's not the right term. You guys were talking about the loss programs and
yes, exactly.
So I think having Sherry or anybody from Nantucket to sit in on these meetings just to listen, that was really beneficial for Amanda and I to listen to how you guys were handling some of your recent, very unfortunate suicides and the loss program you're trying to implement. So I think if any of us could even just listen in to see what you're doing, because our problems, Jackie's right, our problems are magnified, but we also don't have this huge area like you as well. That must be a very big challenge. Cover all of that.
Yeah, it can be. And honestly, that's a lot of the work of the work group is to really try to bring both ends in the middle together. We struggle with silos just like everybody else. And so that's been a lot of the work is to bring folks together, bring them to the table to problem solve. But I don't know if you've been able to be involved in any of the more recent loss team development meetings, but are you on the email list with Stephanie Kelly?
I think Amanda and I are, yeah.
Okay, yeah. We usually meet once a month, and the Samaritans have done a lot of work on putting the nuts and bolts of that program together. So we're at the stage now where we're starting to outreach to providers, a small number to be on a referral base for survivors. So it's good to see you again.
Thanks for being here.
My pleasure.
Anyone else with any questions? I guess it would be curious to see once this really gets going. It seems like you've done a lot of work, but it would be curious to see which school districts really have that open door and want to retain all of this information as opposed to, well, we just have somebody sitting on the panel to appease whomever.
Are you talking about our school counselors group?
Yeah.
Well, and Jackie can attest to this. No, not every school counselor attends. We always invite everyone. It kind of ebbs and flows depending on the topic area, who is more well represented than others. But we have had representatives from Truro, Provincetown, to attend some meetings all the way down to Bourne. So I know that's not exactly what you were looking for, but it fluctuates depending on what we're talking about.
Yeah. Jackie, do we have anything like this here on the island where we have, I don't know if we have a specific form, if you will, that shows what services we have for children specifically. Do you know if we have that?
I'm not aware of it. I would say it would be a subgroup from the bigger project that we're doing. And that hasn't happened yet, but definitely, the Cape certainly is a large enough area so you can pull it out, but the whole children's group, and especially I think right now, there's an awful lot of emphasis on children's mental health and the issues in all grade levels and all ages based on COVID and reentry into the school system and so on and so forth. But I don't think we have anything, I don't know of any that's, brings all children's resources together as a collaborative that's meeting. Does anyone else know of one?
Sherry, do you find it difficult to find resources?
Yes, it is to find resources here on the island as compared to other places that I've been. There's just not a lot here.
So it's not necessarily that you can't find them, it's that we don't have them. Is that what you're saying?
I've only been here a short period of time, so I may not be aware of everything that's here, but just the feedback that I'm getting from counselors is there, as well as from what I've seen, there just is not a lot here. Yes.
Okay. Jericho?
We do have a network of care directory of available services that do offer services here. I don't think there's a specific children's subsection as yet, and I do not believe the GPS Behavioral Health Roundup included any children's specific information. But I think we are planning on relaunching that directory, and we can carve out a children's focused section of it so that we can foreground that as necessary.
Thanks. Barbara, do you think it would be worth our while to have someone look at those surveys that you had, or what, besides the overwhelming suggestion to create the task force or whatever it is you're calling it, what other priorities were there? What were the top priorities that the counselors were telling you?
Professional development and collaboration. And having worked in a school system, I can attest to that. Much of the professional development, I think things are changing, at least here, but much of the professional development was really geared toward educators and special needs issues, which as it should be. But the counselors were finding the need for professional development and training specifically related to school counseling, mental health issues, behavioral issues. So that was one of their requests, and really just to have a collaborative group to really cut down on the feelings of isolation that they experience. So like, for example, our last meeting, there was a huge interest in just stress management techniques because this group of counselors, and I'm sure it's true everywhere, as well as on Nantucket, have been so stretched so thin by the issues created by the pandemic and the crying needs of some of these kids that they're worn out. And so we spent an entire meeting just sharing with one another about our favorite stress reduction techniques, all the way from taking long walks to humor and it was really beneficial and well received. So I would say the top three areas of need for this group from the very beginning have been professional development, collaboration, and training, and communication with one another.
Okay. Thanks.
Kevin, to add to that, one of the things that I never thought about particularly, because when Barbara mentioned education and professional development, and as she said, a lot of the professional development has been academic, or it's been with disabilities, people with disabilities and so on. It's been fairly recent that we really tried to bring social emotional learning up to the same standard. And I think we're realizing that I'm trying to remember the terms, social emotional learning is SEL. What do we call the other learning, Barbara, that is for more the disabled kids or the kids with learning disabilities?
Special needs?
Yeah, and special needs has been legislated for a long, long time. And social emotional learning hasn't been. And I think at this point in our history, we're realizing that that's a huge lack, and we're seeing the results of that lack. And that was something that I never really thought about, that the schools haven't traditionally really glommed onto that as a nation as much as we have disabilities.
I can speak to that a little bit, Jackie, and I think it's even changed since my retirement in 2018, the state actually requires a certain level of curriculum, social emotional learning curriculum. And I think prior to that, you know, there, at least speaking from my experience, there was a lot of emphasis, but not always a lot of training available, and trainings are expensive. So, but I think there's much more emphasis on that now, and especially now because of the issues created by the pandemic. So, I hope that the attention that students are getting with social and emotional concerns just continues to increase.
Okay. Well, thank you.
Thank you.
So are there any future events? That's next on the agenda, future events. I know that the subcommittee met for the community outreach, those packets that we were talking about leaving on doors or in neighborhoods. And we are moving forward with that. One roadblock we did discover was trying to figure out whose number we're going to put on there. We had two individuals within the subcommittee who are community citizens who are suffering themselves. And one of the focus points that they kept bringing up was a centralized phone number. We don't want to have to scramble to look while we're in crisis. We want to be able to contact someone. And so we realize that we need to figure that stuff out. Is it going to be the human resources? Is it going to be NAMI? Is it going to be police department? Those are just three suggestions. I'm not, whatever. But that came right.
You could also put the emergency service, Goswell emergency service number. I mean, it's answered by a person, and even if it's not something that we can directly support, like an evaluation we can point them in the right direction.
Yeah.
So that could be an option.
Yeah, it's going to be on there. It was just they wanted a centralized office number, if you will. But you're actually going to be invited to the next meeting, as is Jericho and Jason. Yeah.
Excuse me, can I just jump in 1 second? Aaron, I wanted to just mention you are more than welcome to join us at our Children's Behavioral Health Work Group as well. So.
Yeah, I think Abby used to go, and she, I think I'm going to the next one.
Good. See you there.
Yeah.
So that subcommittee is working. We have begun updating the website that we continuously use, which is the acbhtf.net. It's the one that NAMI continues to pay for, that we started with the mental health group previously through the hospital CHIP funds. Jackie, did you want to talk about May?
Yeah, May is Mental Health Awareness Month. And if there's ever a time that we want to really push mental health, I think it's now. And I'm starting to try to think of good events to have on the island. Hopefully we'll be having some live events now. And I'd like to get a group of us together so we can collaborate. As most of you know, we do a lot of marketing on the island. We have marketing money. We certainly, if we do collaborative events, we have marketing money to publicize them. So I would like to talk with some of the major players here and see what kind of programming we could get together, and maybe have it all on one thing, so we could run a big ad that lists all events, regardless of whose events they are, or if they're collaborative events. So that's kind of, I mean, this is a good opportunity to really push mental health, and it's a very timely thing right now.
Is this you creating another subcommittee?
Yeah. Unless you want me to do the whole thing myself.
Just being clear on that.
Yeah. No, I think I would say a few of us need to just kind of get together and bat around ideas.
I think last May we did quite well. We had those yard signs.
Yeah, we did quite a bit last May, and that was during the pandemic when we couldn't really get out there too. And this year, I think we should have those signs stored somewhere. As I remember, we should have all that stuff around. So we don't have to reinvent that part of it, but now maybe we can really do some live stuff. I don't know if the hospital's doing anything. They used to have a children's mental health fair. I don't know if we're at the point where the hospital can do something like that or not. I know most healthcare institutions are still masked and limited and all of that at this point.
Here, just crawling out of the cave now, actually. We just had a
Good,
policy
Chris.
change today. Very exciting. We can meet in person. We can meet in non-clinical spaces without masks. And we can invite other folks to meet with us in the hospital for the first time.
Gee,
So
Chris, can we start having this meeting back in the hospital someday?
I think we can very soon, actually. We're resetting up our conference rooms now.
That's wonderful. And do you have the cafeteria that I can buy people lunch?
We do, and we have a fabulous new chef, actually. But we don't have anything, we don't have any events planned yet, because this caught most of us by surprise, this good news.
Yeah, but I know at one time you did, in fact, I think the mental health fair got canceled in 2020, just as everything closed down. We had been making plans for them to be a big presence at the mental health children's fair.
It was a children's health fair that I think had a mental
Yes.
health component to it.
Yeah.
And hopefully that will come back now.
Good, good.
Awesome. Okay. Anyone else have any future events that they want to bring up?
I would like to push next month's meeting of this group, and I've managed to snag Dr. Stuart Alblom, who is Mass General Harvard. He is one of the best speakers in the country as far as educational programming. He's in charge of the Think Kids program, which is a national and international program on collaborative problem solving and dealing with children, meeting them where they're at. And he will speak about not only collaborative problem solving as a way to deal with children of all ages, but also he's going to give us a thumbnail sketch of what he's seeing as traveling around the country as far as children and what the results of COVID have been for them, and especially how to deal with that. So I'm pretty excited about that because he's doing it for nothing, and he doesn't do a lot of things for nothing.
He's
That's a great get, and we should think if there's other people that we should really push to attend that session while we have them.
Yeah, we should. Yeah, Chris, we should get out and really push that one and publicize it, because we can take anybody on this.
Of course, right? So we should think about that. And this is someone that Jack and I have tried to together kind of push forward into the schools and things here, and everyone's been too busy. So this is a great start. Appreciate it.
It's a good opportunity to really see him speak. And I think one of the ways I describe him, and I've heard him so many times now because we did the Think Kids program over here, is that he has the ability to describe very complicated things in a very simplistic way to make people understand. He can talk about brain development, which is, right up there, scientific, but bring it down so we all understand it. And he's very relatable. He's funny. He's just a top-notch speaker. He's enjoyable.
Awesome. Very exciting.
Kevin, I would love to, this made me think of having a speaker series, thinking, maybe we start planning a speaker series for 2023. I know that's really far away, but the other idea I've always kind of dreamed about is the Dreamland does these storytelling nights through the Moth, and they have a trainer who works with you on storytelling. I'd love there to be at least one of those or a series of those to be mental health based, and it could be about loss and anxiety, and it could be funny, and it could be heart. It could be a lot of different things, but they have a coach to take that story that's in your head, but it could be mental health based. So we could really do a lot of those different things in the fall, in the next winter, and next spring. I know it's down the road, but
one of the things we do, Jason, even in our police training, we have what we call a section where we have people that have been trained, because NAMI has a program that they train people that have had mental health issues and are in recovery to speak about the experience. And we've had very good reviews with that from the police, because that lived experience really tells the story of what it's like to have a mental health situation. And I think it's very, very effective in helping people understand, really, really understand it. I think that's a great idea.
Okay, so Sue or Suzanne will send out an email for that subcommittee that you were referring to for May. And
Yeah,
then
we'll
you and I
have
will
to,
discuss when our next subcommittee meeting is for the community outreach that we're trying to do. Maybe it can be one and the same.
well, it'd be great if, and I don't know if we can do it, Kevin, but it would be great if we could get the community outreach to be available by the end of May at least and tie it in with Mental
Yep.
Health Awareness Month.
Okay, awesome. Well, I want to thank Barbara again for giving us her time. It was very informative and a lot of good information.
My pleasure. Thanks for having me.
All right, thanks, everyone.